Good afternoon, everybody. Today is September 3rd, 2021. My name is Scott McGann with the Falmouth Health Department. We're doing our weekly COVID-19 COVID-19 update. Our website is falmouthma.gov, and our email is health@falmouthma.gov, and our phone number is 508-495-7485 if you have questions. So we had a bad week for us this week. Our case count is at 1,746, which is 57 confirmed cases during the 7-day period. And there was 18 probable cases, which is the rapid test that some people get. About 96% of the cases are no longer in isolation. That number will drop because we've had some recent cases. Our daily incidence rate is up from 8.5 per 100,000 daily to 12.8. Our positivity, back to where it was maybe a couple weeks ago, is at 2.44, and we had dipped down to 1.78 last week. Looking at the chart for this week, you can see the 1 week increase. We had about 5 consecutive weeks right around 20 confirmed cases. This week we've had a high number, which is going to, and that incidence rate is a little bit of a delay. The state pulls the incidence rate a couple days ago. The last couple days we've had a high case count. Don't know if that's going to continue or drop. Sometimes it can go away. Sometimes it sort of meanders. Sometimes that's going to be more of a consistency of what we have for a number, but we definitely had a jump this week, which would show this number, and this is the flatter the line, the more straight the line, more horizontal the line, the more vertical line, the higher the cases, the more horizontal we're doing well. You can see that we started, this week was not a good week, and it starts to show in the dot to the far right of your screen would be indicating of a bad week, and that's what we had this week comparative to what we were having earlier. In terms of the county, you can see that the county was averaging, relatively steady amount, and then you can see the last few days, the 30th through the 9th, we see a high case count, and that's kind of what we've seen. So we've seen an increase over the last couple of days in cases, and so that kind of mimics what the county's seeing a bit of an increase over the last few days. Hospitalizations are still steady at about, if you look at the far right, you see the blue number. Between the two hospitals, they were in that sort of 10 to 13. We're at 10 as of the 31st. I get that a couple days a week from the county, and that's the most recent one, which shows that there was 10. Falmouth having 3, 4 the week before, 3 the week before that, 1 and 1 back on the 5th. So it's been really, the hospitalizations have not increased. And when we talk about more mitigation strategies, mandates, things of that nature, one of the factors we should be looking at is hospitalizations. We know that the vaccines work. Doesn't necessarily stop you from getting it, but if you get it and it's a mild symptom, that's one thing versus hospitalizations and deaths. So I've said that plenty of times on these weekly updates, that we haven't seen an increase in hospitalizations at this point in time. There's definitely usually a delay to it, so we do have to keep monitoring it. In terms of the state's been sort of flat around 1,500, roughly so cases a day. The positivity has been hanging right around 2.5. So the 7-day positivity has been around 2.5. It's gone up almost to 3 in a few weeks previous. I have heard, I did hear somebody on the news saying that we might have plateaued with Delta in the state, not quite sure. But it seems like looking at these, the last week or so, that we've been kind of relatively stable with that. Deaths are always a lag, so you're seeing the increase in deaths from, 5 or so to around 15. As a result, from when we went from several hundred cases to 15, is just sort of a delay to that. So that's reflecting what happened, throughout earlier in August, maybe even to late July. In terms of the trends, you can see the 7-day case trend is a bit low. It shows a little bit of a downward trend. Positivity also shows a little bit of a downward trend when we waited for 7 days. Hospitalizations are up, but maybe slightly flattening, and deaths have not jumped up in proportion to the cases, which is what you would think with a high vaccination rate that we've had in the state compared to other states. Makes sense to me. In terms of how we're doing with our peers, here is the 14-day average incidence rate for all the Cape Towns. You can see Falmouth at 12.8. All these are higher, exception for Provincetown and Truro. I believe they're down from the high numbers that they had with the outbreak that they had in July. So they're sort of coming back down to where we were. We're still lower than average for a lot of the Cape Towns. We're somewhere, some of the towns have, all of Massachusetts is 19.8 12.5. Barnstable County average all out is 21. We're at 12.8. So still above average, but still higher than what we've been. And so, that's where we are with that. And in terms of positivity, all of these are a bit higher. I believe all of Massachusetts averaged for that same time frame. Previously when I told you 2.5, they're taking it at different points in time, so sometimes you see these numbers a little different. So I re-show it because this is the 14-day from when the day they started it to the day they ended it, which is the 15th to the 28th. There's a little lag in this data, but that's how the state gives it. They're at 2.74 for that time frame. We're at 2.44. The Barnstable County being at 3.79. So we're still better than the state average, at least in these 14 days. But this is a little bit old data. This is only done for us on a weekly basis. That'll update. And the cases that we've had more recently are not going to be reflected into these two things in terms of where we're at if you add in what's happened over the last several days with the increase in cases. In terms of where we are for vaccine, we're a 1% increase Barnstable County to 72%. Our vaccination rate, we had 312 doses administered, 134 first doses and 178 second doses. Most of that increase was along those under 30. We recently had a second dose clinic at the high school. We did another clinic, I think the 9th and the 31st were the dates with Pfizer. And that's probably reflecting in why you see, somewhat of more of an increase in that age group. We'll continue to do those, maybe do another one in September for school-based. And I'll talk about third doses in a minute. So, small gains. We're at 79% of all eligible residents in Falmouth are fully vaccinated. So you can see that we're having an increase in cases and our vaccination rates are high. So most of those cases, a lot of those cases can be breakthrough. Some of those cases are breakthrough, and those generally seem to be a much milder case. So vaccines do appear to be working against the serious diseases. That's why we're not seeing the hospitalizations, but we do see breakthrough, and that's why we had a high case count, because you've got unvaccinated, add in some vaccinated, and that's where we are for cases. This is provided by the state each week. Percentage of all fully vaccinated individuals represent 0.43%. So that's the incidence rate for that. Total number of cases of vaccine breakthrough in the state is 19,443, which is 0.43 of all fully vaccinated individuals. Hospitalizations among the vaccinated, 651, so which is 0.01% of all vaccinated population. Deaths are 144, which is 0.003% of the population. Obviously, we'll talk about third doses with immune-compromised and also the elderly. The vaccine does tend to wane, especially with a weakened immune system, the vaccine's ability to protect you, so that's why we're getting into third doses. And we'll talk about that in a second. As far as vaccine availability, the Mass Vax Finder, so vaxfinder.mass.gov is where you would put in your zip code, tell you where the vaccines are. Right now, pharmacies are going to be your best bet. Barnstable County Health Office does it once a week. Convenient MD has some. Community Health Center of Cape Cod, especially if you're patient. If you're homebound, call us at the health department and we can make arrangements. So that's where you'd go for vaccine. There was an article in the Enterprise last Friday which said that the fairgrounds is a testing site. And I show it down here, it's a testing site, not a vaccination site at this point in time. So right now for testing, you could go to the fairgrounds on Sunday and Thursday, it's free. Falmouth Hospital through your physician. Of course, you always got Convenient MD and CVS do the most of the testing here in town. And also, we also have the Community Health Center as well. So there's still testing available. There's vaccine available. Just making sure that you know that the fairgrounds is not a place to vaccinate. It probably will be, depending on how the state rolls out their third dose program, which we don't have knowledge of exactly how it's going to be rolled out yet. The state hasn't provided us. So the roles of health departments in Barnstable County, if you remember last time, we kind of helped you find where to go and try to help you figure out and navigate the system. They're not going to have mass vax sites as far as I'm aware at this point in time. They may. So that leaves more to the health departments and to the Barnstable County. I can foresee us running the fairgrounds at some point in time, maybe more targeted approaches depending on how the state allows us to obtain vaccine. I'm sort of holding it, in January, when we started vaccinating. We didn't know exactly how we were going to get it, and it didn't, whether the towns were heavily involved. The health departments weren't allowed to order it directly at that time. That may be different for the third dose. Just not sure at this time. CDC, basically, third doses would be anybody who's moderately or to severely immune compromised is definitely eligible now. The CDC doesn't recommend additional doses or booster. Booster, it's still the same vaccine, so it's not like a booster is a different formulation at this point. At this time, they're not recommending for any other populations. They will be announcing a plan, and the state would be announcing a plan shortly. You'd have to have at least 28 days from your two-dose cycle for Pfizer and Moderna. If you've had the J&J vaccine, that is the information is still pending. Again, talk to your healthcare provider whether you would fall into that moderately to severely immune compromised. And, as information comes, we're ready to go. So if the state said to the next call, our weekly call with the state says, starting October 1st, we'll be able to send you X number of doses, and you'll have to figure out how to we'll be running clinics. If it's going to be more like, well, we want to go through the county, it'll be mostly the county running the clinics, using the fairgrounds. If it's both, then we could run the fairgrounds and run stuff elsewhere. We just don't know at this point exactly how the state wants to roll them out, and once they do, we'll message that out through this and other means as well, through my updates and so forth. Face coverings. So we still have a mask advisory. With the increase in cases, we definitely advising you that mask indoors would be a smart move. The only time the state requires if you're unvaccinated or vaccinated with a weakened immune system or some like public transportation, whether it be Uber or the ferry or things of that nature. The CDC recommends all unvaccinated, just like the state. Vaccinated should also wear masks in areas of substantial or high transmission, limited healthcare system, and vaccination rates. So I'll talk about that in a second. And the schools last week this week, it says this week, that was last week. I didn't update the slide, sorry about that. Required this week to start the school year with masks. That was the State Department of Ed. In terms of when we might have to have a mask mandate, the CDC says in substantial or high. Well, substantial would be an average of about 115 or so cases per week, based on an incidence rate of 50. Would be roughly, 16 cases per day. That's a daily incidence rate. So the 12.8 incidence rate per 100,000 equals roughly 4 cases per day. This, again, that's on the low. We're probably going to be somewhere higher in the moderate, but not into the substantial based on what I've seen in the last few days. So that would not click the substantial. Testing is still well in the low category. If these continue to move towards the substantial, then we'll need to have a discussion with the Board of Health whether things of mandates or so forth would have to be discussed. Sort of the line in the sand is basically the CDC metrics. Also, we take into account hospitalizations, which have not been, there hasn't been a huge increase in hospitalizations because, again, the vaccines work. We're highly vaccinated. You can see here we're very highly vaccinated. So we always have we always have 1 out of the 3, which is high vaccination rate. We always have that. That doesn't go away. Hospitalizations, it's going to depend, but we have been doing fairly well with hospitalizations. And again, it's looking at the incidence rate, the daily incidence rate, and the positivity, and that's going to drive discussion on that. Some people listening to me would totally disagree that we should be fully mask mandate. Some would say you should never do it. So, we're going to have to pick a line, and the line that we picked is using the CDC's indicators, and that's these 3 here, these 3 things here. Well, 4 things, the incidence rate, positivity, hospitalizations, and the vaccination rate. So that's where we are now, and we'll have to keep an eye on it. I think 12.8 is a little low over the last, if you start factoring the last couple of days. You also want to get a good data set. You don't go by 1 day or 3 days. You need to get some data. That's why we do it based on, the state does it based on 14-day. But we'll keep an eye on it, and if things need to change, they need to change. Hopefully not. As far as a recap, case counts definitely jumped this week. Okay, incidence rate jumped into the moderate level. Sustained increase may mean further mitigation. That would be discussed with the board based on the Board of Health, based on where we go. Vaccine is definitely still eligible. Everyone over 12. The town is averaging about 300 vaccinations per week, roughly half and half. First doses and second. Falmouth resident vaccine rates are still really good. Third doses are recommended for the immune compromised. There'll be more plans As the state lets us know how the vaccine would be distributed for third doses, then I would have more information on how that's going to work for us. I just don't have information. If it's all going to come to the local towns, then we would use both the county and the VNA, which we have a contract for. That's who does our flu clinics. We could use both. We could, if it's going to go mostly to the county, because the county has a good relationship with the state, and the state says, well, we'll just send it to you, and it's going to be under county control, then we'll have more clinics out of the fairgrounds. We could also bring the county nurses to do more localized things at different places, whether it be schools or the senior center, stuff like that. We can easily do that. If anything, we've learned as health agents that we can do clinics just about anywhere. Vaccine breakthrough definitely occurs, but definitely is much less a severe illness for the vast majority of people. So it's preventing the severity of the illness, not necessarily a case. Okay, so if all the cases are mild, then that's one thing. If we're getting a high hospitalization rate, then we know the vaccines weren't, and that's not really what's happening. What's happening is they do appear to be maybe not mild to the person that's having it for that week or so, but mild enough where it doesn't require hospitalization, especially ICU. You definitely don't see a big increase in the ICU because of our vaccination rate. So I think, that's a great sign. So as far as this week, that's my update. I'll do another one next week. And, again, encouraging mask wearing indoors, definitely can help. With the cases increasing. And so, that's one thing I'd like you to take away this week, that if you were kind of on the fence or I've seen an increase just, traveling around shopping and doing things like everybody else does, an increase in mask wearing. If you've been on the fence about it or sort of wearing it sometimes and not others, you are, someone who may fall into the, having a higher probability due to your age or your health, to perhaps, even though vaccinated, it might hit you pretty hard, then you really need to be wearing a mask. I'd encourage everybody indoors to be wearing a mask. And whether we get to any mandates or so forth, we'll still have to see. So that's it for this week, and I'll talk to everybody next week. Thanks.